A new treatment for acne just came out. So does that mean it's better than the pre-existing treatments? That's what we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute. We're a dermatology practice specializing only in the treatment of acne. So that's all we do. So we like to bring some of our insights and our observations to acne sufferers who are navigating the path toward clear skin. And we hope you find this useful. However, remember, this is not for medical advice. This is just for educational value. So a common theme comes up in acne treatment in dermatology, and that is there's always a new treatment coming out. So let's look into that. The question is, just because it's new, does that mean that it's better? So it's common for acne sufferers to hear about a new treatment that's just come out, and they want to be the first to use it. They want to get it in their hands as soon as possible because they're looking for that magical ingredient that's going to make their acne go away. So the thing to keep in mind is that just because it's new doesn't always mean that it's better. What we see quite often is that new products do come out, but if we look more deeply into them, we find out that they're not so new after all. In other words, many of them contain old ingredients, just packaged in a different way. For example, maybe the percentage of that ingredient is a little bit different. Maybe the ingredient is used together with another ingredient. Both of them old ingredients, but now they're together, so now we have a new product and we can give it a new name and it sounds like it's a new therapy that's just come out. So we have to be very mindful of that, because what we don't want to do is to pin our hopes on a new product that's really more of the same. It's just older ingredients put together in a different way and given a new name. So it's got a fresh look, a fresh appearance, and it makes us want to use that. But remember, just because something is new does not mean it's better. Now, this could apply to topical medicines, to pills, to laser treatments. It could be a lot of different options coming out into the marketplace. New treatments being developed for dermatologists. But just because they're new does not always mean they're better. So you have to look at them. You have to look at the evidence. Make sure that it is something that might actually give you a better benefit than something that's already existing. Of course, there are times when there is a breakthrough ingredient, something that's not existing, something that is new that really is useful. For example, Accutane. Accutane was not something that we had before, and it was something that came out and it turned out to be one of those life-changing ingredients. It does, in fact, make acne better more than other medicines out at the time. So there is the possibility that a new ingredient might be developed and might be the thing that might help you the most. However, the vast majority of things that come out tend to be repackaged or tend to be tweaked in such a way that they're really more of the same. They're just older things that are used in a different way, but they really don't have that much of a better impact against acne. So keep that in mind when you're navigating the options that are available for treatment, and don't get distracted by something just because it's new that might take you away from something that might be older but more effective. So always keep that in mind. Talk about that with your provider and make sure that when you do decide to use something that might be new, that it in fact has a better potential to help you than something that might be more tried and true or something that might be older that might be more effective.